Are we ready?
Yeah.
Okay. Hi, I'm Patty from Better Health, and I would like to talk with you today about something very serious and very front and foremost on the news. People in Texas are still trying to recover from Hurricane Harvey, and there's multiple storms that are out in the sea right now, churning around, heading for hopefully not the U.S. mainland. So it's a good time to talk again about disaster and emergency preparedness, especially for people with diabetes. We have on our table in front of us some very important things that folks with diabetes should have very ready so that they could leave their home at a moment's notice with these articles. And I would like to talk with you a little bit about each one of them and the importance. The number one thing that is on the table is water. And according to disaster preparedness folks, you want to have 1 gallon of water per person per day during a disaster. So in light of the fact that it's that time of year, we need to get prepared with fresh water. The other thing that's so important for a person with diabetes is that you need to have food. You need to have an access ready source of food that you can prepare or that you can take in that doesn't require any kind of preparation. So peanut butter is a really good source. Non-perishable food items like bars that have both carbohydrates and protein in them are also very, very important. Peanut butter crackers, things that you can get in an emergency. Okay, so we have our emergency medication bag here that is a great place for you to store all the things right here that are on this table that have to do with treating your diabetes. The very first thing that we like for people to have in the bag is a card. You can either put this in the bag or in your wallet so that you're identifying yourself as somebody who has diabetes. Emergency medical personnel will treat you differently if they know that you have diabetes. Another important thing to put in the bag is also your personal medication record. Many of our family members don't know the medical conditions that we have because of privacy. This is a great resource right here where you can list all of your personal information. On the back of this, it's got a place where you can list your current list of medications and the dosages. And on the front, it's got your name, it's got your emergency contact, the list of your doctors, any other information that you want to have in there. The other thing that's so important to have in the bag is a copy of your medical insurance card if you do have medical insurance. So what we suggest for our folks to do is fill this out, review it periodically to make sure that it's current. You can make copies of it so that you can put it in different places, but the most important thing that you can do is put it in your emergency bag with your card that says that you have diabetes. Okay? The next thing that you want to have in there is your glucometer with extra test strips, and you want to make sure that you put it in its case so that it doesn't get dropped or nothing happens to it. You want to have additional batteries because you don't know how long it's going to be before you would be able to get extra batteries for it, so you always want to keep extra batteries with your glucometer. You also want to have extra lancets so that you can check your sugar, and you want to make sure that you've got all of these things in your little emergency bag. All right? So we're going to go ahead and put those in there. This bag holds a lot. You want to have extra alcohol swabs to be sure that you're able to keep your hands clean, your fingers clean, or your injection site clean if you're going to have to inject insulin. All right? Another great thing to have in here is a copy of your blood sugar logbook. This happens to be kind of one that's on the smaller side, just so that if you were unconscious or you were unable to tell someone what's going on with you, a medical professional could look back and see how much insulin you're giving yourself and get a little bit of a better understanding at what kind of control you were having with your diabetes. It's just a good method of record keeping. All right. If you do take insulin, this would be a good place to put your insulin pens and your insulin pen needles. And I've put these, taken some out of the box and put them in a plastic bag, and we can put those in there. And if you As a backup plan, if you've got some syringes, you can always put a couple of packs of insulin syringes in your emergency bag as well, so that you've got those. And of course, if you're on a vial of insulin, you would want to store your vial of insulin in there, okay? Another important thing for you to have in there is all of your current medications in their original bottle. That's very important so that people can see what exactly you're taking, and that includes things like over-the-counter medications as well. So you want to put that in there too. Also, we'll go ahead and put our non-perishable food in the bag. It kind of looks like a Mary Poppins bag. It just keeps getting bigger and bigger. The other thing that I want to talk with you about is how important it is to have a source of rapid glucose in case you do become hypoglycemic or you suffer from low blood sugar, okay? So these are two things. These are glucose tablets, which if you take 4 of these, that will give you 15 grams of fast-acting carbohydrate. This is actually a glucose shot, kind of looks like a little energy drink. It is not, it is glucose, and it also has 15 grams in it, so this is something that's good to keep with you at all times if you have diabetes, because you never know if you're going to get stuck in a traffic jam or what's going to happen, and you may not have food. But if you have your glucose tablets or your glucose shot, then you've got a source of fast-acting glucose. For people who tend to go very low, people that are on insulin, a Glucagon emergency kit is also something that's very important. It's life-saving. For these things, you are awake or alert and able to do this. This is something that your family or someone that you trust is going to be able to know how to use, to be able to give you an injection of Glucagon if your blood sugar is low to the point where you're unconscious or unable to speak. So these are also very important things to have in your emergency bag. Also, for people whose blood glucose is high because you're dehydrated, maybe you haven't packaged enough water and you are becoming dehydrated, your glucose is high. This is also a good thing to have in here. It's ketone sticks where you would dip your urine to see if you're spilling ketones. What happens is we're not taking in food. Our body needs to go ahead and use whatever sources it has, and so ketones are spilled as a result of splitting fat to give us energy, and it's a very crucial thing to know if you are having ketones in your urine. So that's also another really good thing to have in your emergency bag. The best thing to do is to make sure that you're keeping all your supplies dry. Of course, we never know if we're going to be subject to flooding. So I would suggest also, even though this little bag is made out of neoprene and kind of watertight, you would want to keep things as waterproof as possible. So some Ziploc bags in here would also be another really good choice. So you can see that with everything that I put in here, everything fit. And if there's an emergency, if there's a fire, if there's a disaster, a hurricane, if I have to evacuate my home in a hurry, I have everything right here that I need to be able to give myself the care that I'm going to have initially. If you have any questions, please don't hesitate to contact us at Better Health at 483-7534. We'll help you out as much as we can. Have a good day.